compete for height here. It's rare.
Yeah, there we go. There we go. Already? Thanks for joining us. We've just had a really productive meeting with local leaders from a variety of parts of the community of Chelan and Douglas County. Mayors, county commissioners, health directors, representatives of the Latinx community and agricultural workers. And I would just say that there are three fundamental messages that we both heard and talked about. One is that we have a very active pandemic that is very challenging and very concerning to counties. Two, that we've had some real progress in these two counties because of folks banding together. And three, we have to take this to a new level if, in fact, we're going to really knock down this pandemic and be able to reopen fully in our businesses. I'll address each of those in turn. First, the challenge is significant. We have a sort of a target of getting our infections down below 25 per 100,000 over 14 days. That's 25. Our numbers in these two counties are over 500 in one and just under 500 in another. So we are so far beyond where we want to be in the infection rate. We have so far to go. We have to understand that we have to really up our game if we're going to be able to do the things we all want to do, which is to fully open our economy and be free to live our lives the way we are used to. So that's number one, and that's frankly the reason we came, because this is one of the hot spots in the state of Washington. And it's a place that we are most concerned about. It's a beautiful valley full of beautiful folks, but if we're going to return to normal, we've got to up our game. That's our message number one. And everybody in the group discussion agreed to that. Local leaders, health folks, everybody had that common consensus. The second message is that there's been real progress here recently. The number of people who are wearing masks, the number of business leaders who are showing leadership by helping protect their employees and their patrons is really encouraging. And this has been a dramatic improvement in the last several weeks. That's happened because we've had individuals who are showing that they care for one another. As one of the people there said, that's because we want to be protectors, not infectors. And I thought that was a powerful way to say it. And so people are embracing that, and we really appreciate that. We think that the requirement that we imposed legally was helpful, and a couple of the people who said that what we've done, that they believe that was one of the reasons we're having some success in the masking campaign. We've had recent, what we believe will be improvements in the testing and contact tracing protocols. There is a new way of doing the contact tracing. New folks will be able to add that to the effort. So that's good news. There's been relatively good turnaround time on testing, as much as 24-hour turnaround times, which is good news. So there's been real progress here, which we really appreciate. But then we come to the third part, which is we need to up the game. We need to take another step forward. And it has to be a big step forward, or we're not going to control this pandemic. And that means that we have to all be much more consistent in the use of masks and much more consistent in social distancing. Because what we're finding is we're having good compliance in our retail stores and our businesses, but unfortunately too many folks are sort of forgetting about that in our social lives. They're socializing too close, too often without masks. And that's one of the significant reasons we continue to see this pandemic really raging in Chelan and Douglas County. So we also believe that we need to have some additional testing, particularly in our agriculture industry, and we're considering ways that will encourage having more people be tested so we can get on top of this disease earlier. We also believe there's things we can do to provide better health care to some of our folks that have had not total access to health care, particularly in the agricultural community as well, to prevent tragedies from occurring. So it's kind of like life in Chelan and Douglas County. We know that we got a big challenge, we know we've made progress, and we know we have to up our game, and there's ways to do that. And the good news is we know how to do it. This is within our control. This is not like we don't have to create a whole new rocket ship. We know what works here, which is to socially distance and wear masks. So we're very appreciative of people I met with today. They came together at short notice, and we got some good ideas. With that, we're going to help from a local health leader, and then I'll stand for questions.
So good morning, everybody. I'm Malcolm Butler. I'm the County Health Officer for Chelan and Douglas counties. I just want to say thank you very much to Governor Inslee. People who have hair that's gray like mine and have been around for a long time might remember that prior to being Governor Inslee, he represented Douglas County, and I believe lived in Selah for a time, so he knows Eastern Washington well. And I agree with all of his comments. I would say that we've had a very, very good support from the Washington State Department of Health, and Dr. Wiestman is here representing them. We recognize that we really need to make a hard reset, we're calling it, and we're getting a lot more resources deployed into our area. There's an incident command team from the state that arrived this morning. Today we're starting testing with the National Guard. The National Guard has deployed into the north part of the county. We're going to start testing in Bridgeport today. Later this week, we're going to be in Chelan and Manson. So we're going to increase the testing. As the governor mentioned, we've got several other strategies to make sure that happens. But as was mentioned, we're doing good with masking, right? I mean, if you go in the stores, pretty much everybody's wearing their mask, and we appreciate that. We think that's been impactful. But every single one of us has been to a park, or driven past a soccer field, or driven past a house on your street with 16 cars lined up in front of it. This is where the disease is being transmitted. It is in social gatherings where we're having fun. And as the governor pointed out earlier in our discussions, we are humans. This is the hardest thing we have to tackle. How can we remember to wear our masks even when we're with close friends, with close family, and having fun? So I'm going to leave you with one thought today. When people are buying groceries, and they find themselves buying not 5 pounds of meat, but 20 pounds of meat, and not 8 hamburger buns, but 16 or 24 hamburger buns, you need to think twice. And you need to make a commitment to yourself that if you're going to be putting on that size of a gathering, you're going to provide masks, or you're going to make sure that people are wearing masks. It's those small behaviors that we make every single day that need to trigger us to think, uh-oh, maybe this is a time when I need to be careful. Because we're doing it. The curves are coming down. The masking has worked. It's an old-fashioned instrument, and it's the only thing we've got. And people take off their masks when they're swimming in the lake, when they're skiing in the river, when they're hanging out at barbecues eating, and we've got to change that. So if you're invited to go on the river, think about it. If you're planning to go and play soccer with 20 of your closest friends, remember that the governor's guidance has been groups of 5 because we feel that's safe. And I'm the first one to tell you, being outside is the thing. We've all got to be doing it. But being outside, clustered around a barbecue, drinking beer, laughing and joking without our masks, that's where the disease is being transmitted. So let's think about this when we're at the grocery store. Let's think about this when we're planning to go outside and have fun.
Thank you. Happy to stand for questions. We have John Wiestman, our Secretary of Health, is here too. John, did you want to add anything? Okay, but if he'll happy to stand for questions too. Yes.
Well, particularly this Saturday, there was a protest in Memorial Park in Wenatchee, Farm Workers for Protection, and they had a lot of concerns. The state hadn't done enough in order to protect farm workers. The exact quote was that farm workers sacrifice land of this kind of state right now. Do you have anything you want to say in regards to that? Or?
Well, listen, people who work in the agricultural industry ought to be considered heroes right now because we're making sure we're fed during a pandemic. And they're working in very difficult conditions. The agricultural industry, by necessity, folks are exposed in situations that are a lot more dangerous than a lot of other industries. So we have tried to do everything we can to minimize the risk. We've embraced some of the most aggressive rules regarding housing, regarding hygiene in situations. We're taking enforcement action to enforce those rules because we consider it very important. It's important for them, it's important for their families, and it's important for the broader community. Everybody has a stake in seeing to that agricultural workers do not become infected. So, and we continue to look at that. As I've indicated, we're looking at some potential new rules to encourage more testing of folks in the agricultural industry. We think that that's important. We may have more to say about that in the near future. So we are looking for ways to improve the situation. Today, and in my discussions in Oakland County last week, Okanagan County, we also think that there's things we can do to improve medical care, medical access to people, to make sure people do get access to medical care in the agricultural setting. So we're looking for ways to improve that. Today we got some good ideas about how to increase coordination of that, communications for folks to be able to get care. One of the things that the medical profession is learning is that people are hypoxic and are not aware of it. They have lower oxygen levels than they're really aware of, and they get in dangerous low oxygen conditions. So access to pulse oximeters is something we might want to think about, to have more access to that for people who are symptomatic. So we're continuing to look for ways to improve those conditions. But people need to realize this is not a risk-free week. I would love to eliminate this risk. It would be so wonderful thinking we could have all of our food produced and not have risk. And frankly, that's impossible at the moment. So we're doing everything that we can. The other thing is we encourage people to be vocal as well. We need agricultural families to be vocal. We need nurses to be vocal. We had a nurse, a practitioner there today talking about how the nurses are being stretched and they're exhausted and they've been heroes. And their voices need to be heard in this. So the fact that there's folks in the ag industry speaking up, there's folks in the healthcare industry speaking up, we need those voices so we can continue to be aggressive.
What specifically is the state going to do to help out North Central Washington? I know you mentioned, the National Guard and improving contact tracing. Do you elaborate on that or any other examples?
Well, we're doing a lot, I think, and we should be doing a lot. One is to add resources for the contact tracing. The state of Washington Department of Health is doing that now for Chelan and Douglas County. They also have a contract to bring in a private contractor. Second, we've increased testing. We're bringing in the National Guard to help run some of these sites. And as I've indicated, we may be adopting some new rules to increase testing legally required in the agricultural industry. We've brought in teams of our epidemiologists, Scott Lindquist, who came over to help build a more robust and coordinated effort on the contact tracing effort. We are also doing a communication to communicate to people about how to protect themselves. And we're doing this in the Spanish language as well as English language. This is extremely important. And we have kicked in dollars that we have sent to the local community to create that really sort of locally directed, locally created campaign. And that is happening. I'm glad they told me some of the money's got to the local community to do that. So yes, we've done a lot. We will continue to do a lot. In the north central areas, obviously the reason I'm here is that this is a hot spot in the state. We got numbers over 500. We're trying to get to 25. So this is a place we have to have progress. It's just required if we're going to get on top of this pandemic. Now, we've had some, in the past, some controversy about these things. The good news is I think we're over this controversy. We're over the controversy of masks. Everybody knows masks work now. We know it's the law, and we're getting great compliance, right? So both business people and patrons are complying with this. So that's an argument in the past. We don't have to have that argument anymore. But now we need to use it more in a social setting to make sure it's really effective. Joe, am I leaving anything out?
You're good.
Okay.
In particular, is the Department of Health going to be bringing direct resources to bear, like similar to what they did in Yakima?
Well, they are, yes. We're doing the contact tracing. The State Department of Health is providing the person power to do that contact tracing. We are bringing the testing, actually to do the testing by the National Guard. That's the state doing that. So yes, those are direct resources. Now we also have our health care that we're providing And I'm happy that Washington State has led in healthcare. We have 800,000 people who are insured because of the work we're doing in healthcare reform. Now, with people in D.C. trying to take that away right now, but we're going to continue to make that available. Anything else?
In particular, one concern that was raised was the amount of tourism
Yes.
that's going on in Chelan and Okanagan County.
Yes.
Is the state considering anything in regards to that?
Well, yes, we try to encourage people to avoid unnecessary going to places where there's congregations and overloading the medical and business assets of smaller communities. So we have had a communication strategy to help in that regard. That's always a fine balance because some of these places want business too. So it's striking that balance is sometimes a problem. But we're trying to encourage people not to overload local communities. Okay, anything else? With that, please be safe, wash your hands, mask up. Thank you very much.
Thank you, Governor.
Take care. Good to see you. I'll shake hands with you one of these days, just probably not this week.
All right, that's okay.
Okay, take care.
And in addition, was divided funding